It is true that from a 21st century perspective, things are unprecedented, unpredictable, and we have certainly had to pivot. But it is not new to human beings. 21% of children in Hamilton County live in poverty. That's 1 in 5 children, over 16,000 children. And when we begin to look at which neighborhood you live in, that number gets even higher. This is Chattanooga, and this is our community. This is why Lifespring exists. Lifespring exists to demonstrate the love of Christ by providing a pediatric clinic with exemplary medical staff and innovative services, embracing the whole child, serving their family, and transforming our community. They meet with our families and discuss their social concerns and needs. They connect them with resources in the community, and they are out in the community visiting them in homes, and during COVID, they're visiting in parks and outside spaces. Also this year, we moved into a new space. This has been an incredible blessing. We had no idea how much of a blessing it would be since we moved in the middle of a pandemic. However, God in His mercy and in His wisdom knew that we would need a place that would provide a safe space for our staff and for our patients. It's been an amazing building, and we're really grateful to be here. In 2019 at Lifespring, we had over 4,800 doctor and nurse visits. Our community health workers had 509 visits. The total number of patients that we served in 2019 was 1,586. The total active patients that we have are 2,300. In 2020, we continued to see patients without closing our doors. Children and youth with TennCare Medicaid made up 64% of our patient volume. And though we saw a decrease in the total number of patients seen because of the pandemic, we saw a rise in the percentage of uninsured patients from 21% to 25%, and a decrease in the volume of private patients from 14% to 11%. We began coronavirus testing on March 17th of 2020, and on May 1st, we diagnosed our first patient with COVID-19. Since then, we have done 334 PCR tests on Lifespring patients. 38 were positive, giving us a positivity rate of 11%. In addition, 32 rapid antigen tests were performed since the fall on patients with symptoms, yielding 4 positives. As a service to our patients' families, we sent 106 PCR tests on patients' household members, 14 of which were positive, revealing a positivity rate of 13%. During the summer, we joined efforts led by SEMPA in partnership with ALEO to perform pop-up community COVID-19 testing. However, in the fall, Lifespring, with the support of the health department, began offering free testing at our old office on Macaulay. To date, we have collected and sent 1,390 PCR tests, 15% of which were positive. We also performed 571 rapid tests on individuals who presented with COVID-like symptoms. 21% of those were positive. The tragedy of COVID-19 is felt most poignantly in the neighborhoods we serve. This is where our community health workers stepped into action. They walked alongside of families, helping them meet their needs in a time when they needed it most. At Lifespring, we are committed to addressing the racial and ethnic disparities in healthcare. Every day, we provide affordable, compassionate, and loving care to patients who are of different races and different cultures, trying to be culturally sensitive and demonstrating the love of Christ. It's pretty clear that we will be dealing with the effects of the pandemic for years to come. We hope that you will continue to walk with us as we serve our community.